Good afternoon, everybody. Welcome to Khanversations. Today we are speaking to Dr. Afshan Anjum, who is a practicing psychiatrist. She's an assistant professor at the University of Minnesota. She's a very, very accomplished medical practitioner. She has 2 fellowships, one in child and adolescent psychiatry, the other one in schizophrenia and psychotic disorders. She also has a graduate degree in microbiology from the University of Texas. So she teaches as well as practices psychiatry, and today she's going to talk to us about the mental health side of the coronavirus pandemic crisis. Hopefully she will be able to provide us insights which will enable us not only to prepare for what's coming, but also provide insights for policymakers so that they can prepare, allocate resources, maybe even develop programs to counter the mental health consequences of COVID-19. So welcome to Khanversation, Dr. Anjum.
Thank you. Thank you. That was a very kind introduction.
How
are you doing?
Yeah. You're welcome. And I didn't want to go through your whole CV. It would take a long time. And so I'm going to jump right into it. As you realize that this is one of the most catastrophic events that has hit us in a long time. And people who are thinking deeply about the consequences of it, especially those who are looking at politics and economics, think that this is going to have a transformative impact on the global order, etc. So it is going to change the world significantly, and the world at the end of this crisis, which probably will be once we have a vaccine and some kind of treatment that is sustainable, we might realize that we are living in a very different world. But today I want to ask you is, what are going to be the immediate and then long-term mental health implications of coronavirus pandemic?
That's a very good question. I think as we kind of ramped up our services and shifted, we did realize that this pandemic is going to upend our lives, and we have all felt the impact of it. And more so for people with the least resources and who have difficulties navigating normal day-to-day life as it is. And so I've seen that actually play out in the clinic. And so as we have moved to remote telemedicine, I can see that playing out. The young people who walk into my clinic, you're mostly aware of as the news media informs you that there's a lot of anxiety, there's family dysfunction, there is depression. And that's what you're seeing in even healthy people. You know, when you don't know for sure what you're actually battling. We are at war with a virus that you can't see, that nobody has ever experienced before. We have some man-made disasters, some natural disasters we have experience with, but there was always an end in sight, and some of us were watching it from a distance. Now we are in the middle of it. And so some of the impacts you're seeing are going to be long-lasting. The precautions we are taking with social distancing, school closures, and the consequences of business closures, how people are getting laid off, and the economic upheaval it causes, and what is the impact of that on families, on your young people, on their futures. I mean, those things are playing out a little bit, but in time we will know what that's going to look like. And like you said, in a year or two, we might have a vaccine or cheap treatment that would be available. And so not knowing, none of our leaders know, none of our scientists know, not knowing what is going to be in future, if we have an epidemic or a pandemic that can be contained, that causes a lot of anxiety in people. So that will continue depending upon how people show resilience, right? Some people are born with resilience, some people can build it. If people are not very resilient, I think they're going to buckle down and they're going to have very negative outcomes. And although they said the virus is not going to discriminate against the rich or the poor, or is going to cross over social barriers, but we have seen that health disparities, that inequity is quite exaggerated with this virus. We've seen it play out in New Orleans. We've seen it play out here in my community as well. Who has access to care? Who can navigate the technology? Who can make the shifts? Whose medical health, physical health can be maintained? And if that's not maintained, and then how does that affect the mental health of people? So, I mean, there's a lot to talk about the trauma of it. You know, people, young people, how they deal with trauma, how they deal with the structure that they're used to being gone right now. They don't know why mom and dad are at home. They don't know why school's closed, why they can't meet their friends, why their spring break has been canceled. And then you have these parents who are dealing with a lot of stress on different fronts. They're trying to juggle a job. They're trying to be a mom and a dad at home. And also now they are now trying to be school teachers, trying to keep up with the long distance learning. So you can just imagine what havoc it causes in the family and the family systems and communications. And so how do people navigate that? And then there is the other end of things where there is going to be people who will succumb to this. Loss of relatives, loss of grandparents, things like that. Not only is there a physical loss and barrier in communicating, meeting all those people, but also if they do lose their dear ones, because also the virus has shown that it's not going to discriminate among young and healthy versus old. Old might be more vulnerable, but also we have seen some very young people succumb to it. And so those kinds of, so not knowing, sitting with uncertainty is hard for a lot of us, people who have been used to controlling our lives, predicting things, moving on, making plans for years together. And life, you said, is not going to be normal. We're going to have a new normal, and we can't even imagine what that's going to be. And you also said the care delivery, we're finding already gaping holes with the remote delivery of care, telemedicine. And it would change people who are at the front lines. My colleagues who are in the internal medicine units, in the critical care units, also the essential care employees. Some of them have lost their jobs, but also some of them are having to brave um, the anxiety that they might get ill and that they might bring back the virus, right? So this is going to persist.
Dr. Anjum, we realize that there are going to be clearly many psychological implications of just being cooped up in home for months and months, fear of losing jobs, and also dealing with people regularly. I have colleagues who are saying that their pets are not used to human beings at home, and so even the pets are getting cranky. But I looked at the data for SARS 2000, and I think it was in 2003 that we had a major epidemic. And it caused a 30% spike in suicides. And a lot of people were actually killing themselves as a result of that epidemic, people who couldn't find cure or people who were suffering. One of the consequences of this particular epidemic and the way we are responding to that is going to be a major loss of jobs. Many small businesses may actually go bankrupt. So besides anxiety, fear of uncertainty, is it possible that we might actually see a spike in suicide rates or a spike in crime as a result of the desperate circumstances in which people might find themselves?
I mean, that's one thing we fear. And we definitely are afraid that that's going to happen. Like you said, one is because of the losses people have sustained, whether there be economic losses or losses losses of family members. Definitely spike in suicide is going to be one of our concerns, and that's something we are watching out for. And the other thing that's happening is there's also a spike in substance use. So sometimes inadvertently people can hurt themselves using substances or overdosing on substances because they're not able to tolerate the psychological and emotional distress. So that definitely is a worry. And you talked about crime being increased. I hope we don't get into desperate situations like media has sensationalized some people, attacking each other to, I wouldn't say hoard, but to prepare for this uncertainty. And if people are watching those kinds of situations and you're not able to prepare for contingencies, for emergencies, they might feel hopeless and helpless in those situations, and that can lead to, wanting to give up and suicide. On the other hand, like what you saw, people can get aggressive, being cooped up, getting angry, getting disillusioned with life, not having a meaning or purpose in life can drive people to hopelessness, despair, and also suicide, but also some acting out and risky behaviors. I was kind of glad, but I heard early on when there was a lockdown, people were speeding at unusual speeds, and they didn't have any place to go to, but they were driving recklessly. And that was the other thing we were worried about, and we're still worried about is, will substance use, increase in substance use, affect people in ways that they'll behave indiscriminately or recklessly and cause harm, not only to themselves, but other people as well.
I was talking to a local senator, and he made an observation which kind of surprised me, and I had not thought of it at all. He said that one of the things that we might expect, and unfortunately, I spoke to a lot of policymakers. There seems to be no policy initiative to deal with this eventuality, but there seems to be a fear that there will be a sudden spike in domestic violence and child abuse. And so as a result of people unable to cope with the anxiety, maybe loss of job or loss of dear ones. So while they may turn towards substance abuse, they may also just turn towards family abuse. Have you seen any such cases already by now?
That is a worry right now. People, like you said, even pets are not able to tolerate humans. And so with the school closures, when parents used to have some respite, the schools used to be able to take care of children, especially the vulnerable ones. They had structure and everything, so parents used to get respite. Now daycares are closed and the children are around, and especially if somebody is vulnerable, if a parent is not doing well, you can see how they can become upset and start abusing, and that can result in child abuse and also domestic abuse. The other thing is if you have a young person who has, say, an illness where they're not able to communicate, like intellectual disability or cerebral palsy or autism disorders, where people might get more anxious and may act out. And these people have required a lot of assistance, and we're getting those accommodations at school, and parents now have to handle these behaviors. And there they might resort to abuse of these children to get them to quieten down or not to act out. And I have heard about young people even returning from colleges where they have been diagnosed with depression and things like that, where parents were not used to supporting these young people. They didn't know how to handle this. They didn't handle it while those kids were home because they were healthy, and some people returning with any kind of vulnerability or being hurt or traumatized while they were gone and living outside of home. When they have returned, now parents don't know how to help them. And these young people might act out and might, instead of getting support, they might get hurt if the parents start acting out as well. The other thing is with the lockdown, what is not happening, and it should be at the forefront of our policymakers, our governmental agencies, and the mental health providers, is when domestic abuse is happening. We've had reports of those happening. If there is some kind of a documentation of that, some record somewhere, I think the police or whoever those agencies are have to keep an eye on those families and have plans for how to help those people out. There was a scary situation I heard where a man actually had locked himself up and was threatening to hurt his family. And so in those situations, how do you get these people out safely? And these people cannot run and find shelter or a safe place because there's a lockdown. And so the legislators and the state and the county services will have to plan about how do you get these young people, children, or the victims to safe places. And I think that hasn't happened in the planning mode here.
You know, I I actually went and read one of the papers that you wrote. It was published in the American Journal of Psychiatry, I think. I didn't understand much about it. It was talking about a 13-year-old child who may have suffered from latent schizophrenia, I think. So you
Correct.
probably know which paper I'm talking about. So I read that paper, even though I didn't understand that, but I took away something which is very scary, which I had never thought of, that even children can suffer from PTSD.
Mm-hmm.
So PTSD is something that can become latent and surface later in their adulthood, or it could even. And so I'm looking at kids and children today who are cooped up. Some of their, I mean, they're not used to the situation probably. They're missing their friends, their regular activities. My daughter, who is a high school student, and she's wondering now what's going to happen to her graduation. Is it going to be virtual?
Yep.
She's excited about going to college, but is there going to be, so there is already this uncertainty and anxiety. So so it's not just that that people who are losing their jobs and are. I wonder what kind of a long-term impact this crisis may have on young ones who are often neglected. You know, when we study mental health, we simply assume that children are children.
Yeah.
You know, and what do you? I mean, what kind of scenarios do you think might be? Should we be looking forward to?
So this generation, the millennials and the Z gens, this is a very unique group. So I was looking at a survey where they were talking about the mental health crisis in America. And so what was a surprising finding is, you know, like you said, we don't often think about children as having chronic illnesses or even mental health issues. But this generation seems to get a lot of their information uh, from their peers, from the social media. And so they might be misled, or they might be even not seeking care from the people who are experts in this field, or might not even bring up to their parents the worries they have, or because they think they have this social group outside who can take care of themselves, and that is in those circles that are virtually living, correct? When you see them, they're on their screen so often. So that's one part of it, which was surprising to us, that these young people are not reaching out and accessing care. This is not for lack of what you say, insurance or any of those kinds of support, but within themselves they're deciding that they have a peer group or they have enough social network that's going to sustain them. And then you also said about how is this loss about with social distancing. I think these people, like you said, we're not used to, and so it is a different form of cohabiting that's happening here. They're used to rules, especially young people coming back from colleges. They were used to certain kinds of rules, and now they come and they have to negotiate those rules. And so instead of even negotiating and then the family having time because they're pulled in different directions, if they're not able to sit at the table or sit somewhere and discuss and have a shared family plan of understanding of the illness and what to expect from each other in terms of rules and expectation around housework, how do you maintain, how do you make it so everybody is able to survive and come out less unscathed. I don't know if anybody will come unscathed, but with the least impact. And so those kinds of conversations have to happen at people, with families, with your young children. And also, how do you create community, although you are cooped up in your homes, although you are being advised to be socially distancing? They know how to do that, but the family has to establish routines. They have to establish a way of connecting with the family, with their children, and having at least one or two regular activities during the day. So you kind of get each other abreast of what the plan is. And then I also talk about talking, not exposing them to the social media too much. That is traumatizing. We all soak in that information, and just having that going on 24/7 is not healthy. It sinks in. And when you talked about trauma builds up. They're children who can bounce back, but they have to have supportive parents. They have to have a safe place where they can have those conversations without being, say, put down, with a feeling like they're heard.
Basically, you're saying that all of us have to be the best versions of ourselves if we are going to come out of this this pandemic unscathed. I want to present this provocation to you. You know, even before the coronavirus pandemic, America had a pre-existing condition of mental health problems. And suddenly we were talking about a mental health crisis across the country. And some of the data that was manifesting as a result of the mental health condition was elevated incidences of suicide, high rates of PTSD, partly because of the wars, obviously, that we have been fighting, but also the heightened substance abuse, the opioid crisis, etc. All of these were signs that that the country, even though it is in a way healthier because our life expectancy overall had grown, but for the last 3 years we have seen that we are the only developed country whose life expectancy is on the decline. But in spite of all of this, we have all of these crises already: the mental health, the opioid crisis, and then this enormous inequality that we see in the country, which is now being exposed. So this is not the first time that Louisiana has displayed its poverty. And if you remember when we had before Katrina, at that time also, we suddenly realized that there are some people in America who are very poor, who are actually suffering more. So there is also that. So given all of these pre-existing crises, coronavirus, I think, is probably going to have like a multiplier or the force multiplier effect on all of those crises. And it is quite possible that we may focus on new problems that may come from coronavirus and then neglect the older problems. I mean, do you see what I'm trying to say?
Yeah, yeah. So I think with the mental health crisis, I don't want to neglect physician burnout. That was to epidemic proportions also. Yeah. So we will talk about that. I want you to visit that, because that's another field that has been neglected. And so mental health crisis, like no matter what report you read, it is clear that more than 50%, the reported number is 56% of American adults are needing some kind of mental health support.
56%.
56%.
Wow.
But how many of those are actually able to access care is like 1/4 of that, I think. And there are 2 million children who are needing some kind of emotional intervention, and not a lot of them are able to access.
How do we know? Like, how do I know that I need one or not?
I mean, because if you're not, I mean, if you know, all of us have day-to-day experiences that might put us down. You might feel low and you might feel helpless. But if you're not able to bounce back, if it affects your everyday functioning, everyday relationship interactions, your job, if you're not able to perform to 100% of what you are, then that might be a time you want to kind of even visit with your regular doc and discuss that. Most of our primary care doctors are able to kind of screen you for depression, for anxiety, for other mental health issues. And so what we have learned with all these surveys and taking a real careful look at the mental health of the country is that access seems to be the biggest barrier. So even people who have insurance cannot access the kinds of doctors they want to access. Say if it's a child psychiatrist, we have about 6,000 child psychiatrists serving the whole of the United States. So in some places, even for 100,000 people, they do not have a child psychiatrist available, especially in the rural areas. So, there are big pockets in our country, in some counties, where they do not even have a adult psychiatrist, where the general practitioner wears the hat of the child psychiatrist. And so very few psychiatrists and fewer child psychiatrists, fewer doctors who specialize in chemical dependency issues like that. The problem is prevalent. It's more prevalent than some of the medical conditions you come across and talk about and spend hundreds and thousands of dollars on research and also for treatment. But there have not been enough dollars sent. There's no mental health parity. A lot of my patients, after they get to us, are not able to stay with us because their insurance does not support their 12 visits or 24 visits as they need. And so they have to choose between staying with a psychologist, going for therapy, versus visiting with a psychiatrist who is managing their medications. And so those are difficult choices people are making. Although this has been on the table for a long, long time, I don't think everybody has taken any bold step to make mental health
Well, you know, uh,
equal.
the defects of America's mental, not just mental, the medical system is a Pandora's box. I don't want to touch, but I was astonished to find out very recently that we are at least 100,000 physicians short. We need at least 100,000, and it's tough. Even somebody like me who has good health care, and I come from a community which is overflowing with doctors. I have trouble getting appointments for various reasons. But I also read something very problematic and troubling about the coronavirus is we have probably over 500,000 cases already in the United States. We about 2,000 people are dying every day for the last 1 week. And thousands are recovering, but the virus seems to be having some kind of an impact on brain and neurological functions. So, which means that people who have recovered are going to also have mental health issues, which probably psychologists will not be able to handle because these are direct biological and biochemical implications of the coronavirus. Can you shed more light on what that is?
Yeah, I don't think the science is clear to us at this time, like everything else about coronavirus. How do you deal with it? Why does it call ARDS? And why does it spare some people versus affect other people? How is it that's impacting young, healthy people? So there's so much to learn. And that is what's clear is we don't know a lot about this virus. I'm glad you picked up on the point about the mental health impact. It's not so much the behavioral impact. I think what we've seen is it's causing some kind of an effect. Is it a neurologic effect? Because of a few people who have come out healthy, having survived interventions and all of that for coronavirus, have come out and said, we don't really remember, and they're having difficult time with their memory and finding words, communication. And so even during their recovery, there's a lot of aloofness. And so there were interviews where you could catch that, but nobody has kind of pointed to that. And I'm sure people are looking to see how it's impacting the brain, what kinds of, like you said, downflow sequelae will we see, which is certainly an area of interest for me and should be focused upon by neurologists and psychiatrists, I think. So definitely going through the whole process of being intubated and being gone and is traumatizing. And so we'll have to see what impact that'll have.
See, there are potentially three kinds of scenarios that we face. One is that we come out of it by June, in the sense that we have enough control on this, at least so that the hospitals are not overwhelmed by people who are getting infected. And so we open the economy, and the economy is a V economy, as I say, it keeps coming back. The second scenario is that maybe we have to wait till August, September for it to try to resuscitate the economy. And then if we go up to December, which means we would have 2 or 3 quarters of negative growth in the economy, which will definitely mean we are into a recession with unemployment rates of 20–25%. So the focus of the country would be so acutely on economic recovery that I think mental health issues are going to be completely marginalized and sidelined. As it is, if you look at the $2 trillion stimulus package that is coming out, I don't see much allocations to mental health now. We could have catastrophic effect if, on top of that, in many states, alcohol stores are deemed as essential services, and they are open. So yes, it's quite possible there is substance abuse also going up besides other forms of abuse. How, I mean, are doctors like you making any effort to inform the policymakers that please do not overlook the mental health side of the recovery and preparedness for the next few years?
Yeah. Because I think Fauci was talking about a scenario where he said we have to keep up front. We have at the front end, we have to be at the front end preparing for this virus as it spreads to different states. As he was talking about a preparation to combat the virus in where it's going to cause acute illness, right? And the same kind of preparedness, he was talking about procuring masks and all the PPE. But the same kind of preparedness we have not talked about in terms of mental health, right? These are very vulnerable people walking in, families that are losing these patients, or families who will have these patients going into hospitals, being isolated and all of that. And even families in very cooped up places having to self-isolate because they have been in contact with somebody else. Can you imagine those people? And all our essential workers returning home every day, wanting to stay away from the families. I mean, this is causing a lot of mental health impact, emotional impact, which we are not able to count in terms of, you know, how many people are affected. And so it's it's, if you look at one person who's impacted, there are so many other people who have been impacted by being in contact with them and having to self-isolate and all of that. And those numbers we never are privy to, are not focusing on at this time. And so what people have to do, what policymakers have to do, and people who are funding have to do is actually prepare people to be screening all these patients and families for mental health issues as you are screening them for the COVID issues. And that training has to happen, what we call about psychological aid. If somebody is going through some kind of an emotional imbalance, or, you know, some decompensation due to all of these stresses, people have to screen them. They have to know what services they could be sent to and how their spirits can be bolstered, or they could be saying they could be getting help from an expert. And that has to happen at the front end of things. Just like you're screening, you should, for COVID and travel and all of that, you should be screening for their mental health vulnerabilities also, along with the nutritional supplies, availability, all of that.
You know, one
Are
of
we doing,
yeah.
sorry, APA is in a big way fighting for those resources. We're also talking about, I mean, this stress has not gone away. Every day we talk about, there are some patients who don't want to come back and see us because they don't think their insurances are going to support their visits with us, because this is an uncharted territory. And they don't think their video visits with us or telemedicine visits are going to be supported and so are paid. And so people are shying away from seeking care, even though they realize that they need care. So how are the policymakers, the funders, people who are allocating money for various services have to be very, very vigilant to that fact that some people might not be accessing mental health care for that reason. And those policies are shifting every day. They tell us they'll pay, they say they don't, and then there are so many other restrictions about who can treat who. Like there's a big debate about, can I treat a person via remote telemedicine visit who's living in Wisconsin? It was okay for them to come and seek that care at the University of Minnesota. These were my patients, I was treating them. And now they are in Wisconsin or in another state. Now they want to know, if we can cross those borders, will my license be okay for them to be treated by telemedicine? I mean, these kinds of actually barriers and obstacles that have been created within the recent times. And those things people have to look carefully and not make those things barriers, and help us to kind of remove those and make it easier for people who need care to access care.
That's absolutely fascinating. I find it is so complicated, and we seem to be approaching it in such a casual manner. This crisis, you know, the famous phrase that the patients have taken over the asylum, and that's a very good description of the way our government is responding to it. You know, people who. But I want to turn to another issue. And with the Ramadan coming in, people are already very stressed. And I had always tons and tons of emails about, should I fast? I'm a doctor. Should I go and fast? What about the fact that my parents, my father is fit, he's 70, but I don't know what if he gets dehydrated and we have to take him to the hospital, and he may, you know, get infected while he's there, and so on and so forth. So there are lots of these anxieties. And in that context, I wanted to know whether you have any insights about how religious traditions, religious practices, and spirituality can become a source of comfort in these moments, and also play a role in reducing potential domestic abuse, child abuse, and other forms of coping behavior which are dysfunctional. So can spirituality in some way be advocated as until the vaccines show up?
I would totally support that with my patients. We talk about holistic care, and one of the components of that would be the spiritual care. And also what are your family values? I encourage patients to talk about it, to, like you said, discuss all of those barriers, obstacles they might be facing in keeping people healthy. So I welcome them. I facilitate those conversations. We call what are culturally informed practices. And I think spirituality, because when I talk about suicide and stuff, that is something I rely on to help me kind of help people navigate that realm. Saying, if they are spiritual people, I say, what is your religion? If you're a person of faith, what does your religion or faith say to you about suicide? And the people of faith do say, oh, that's prescribed in my religion, and so I'll go to hell. And I say, how do you feel about that? And so those kinds of conversations, when people let you go there with their permission, you're able to help them navigate that and parse through that, sort through that. And I think spirituality, having faith, they all are protective factors. They actually bring people together. They give them a value when everything to aspire to, values and a higher moral ground to aspire to, when everything around them is crumbling. I think faith is something very, very good to lean on. And I would encourage and advocate for people to kind of look into that and seek comfort.
In the last 2 weeks, I started something that I usually in the past have not done. And maybe because I have more time now, because I haven't left home in weeks. Yeah. So I've been calling older friends and relatives and basically asking them, how are you doing, and are you fine? And I thought that, at first I thought that what I'm doing is something very nice. I recently wrote a book on Ahsan, to be good. So I thought I was being good and asking people. And then I suddenly realized that maybe I needed it. Maybe I'm calling other people, not because I'm trying to provide some kind of comfort to them, which it does, but it's quite possible that, it is good for me also. So I have a feeling that there has to be some kind of a mass education for people to be sensitive to their own individual mental health situation, and like now South Asians are so worried about their heart condition. We are constantly checking our cholesterol level. I think we should also worry about our mental health situation. Basically trying to say that perhaps we need to develop some kind of, heart condition is a big thing in my family. So we are constantly focused on the cholesterol levels and blood. We're doing our blood work. And similarly, I think it is time that people start also having some kind of a measure of their mental health. And, we should annually perhaps at least do a mental health checkup like we do a physical health checkup, something that maybe even our employers should mandate. Don't you think so?
I thought that was part of your physical checkup. They should have been screening you for that. Remember, you have to do a PHQ-9. Aren't they doing it? There are some measures that,
Okay.
you're supposed to rate for your depression and all of that. It's called the PHQ-9 measure. And so there are measures like that, but interestingly, yeah, you won't access those unless you show up in your doctor's office, right? And what I'm hoping is, with everything going tele and remotely, you could do a lot of these and easily do this even before you show up at your doctor's office. Or your doctor can, as part of your health checkup, send these around on a yearly basis and have you rate those and maybe bring you into the clinic if there is anything concerning that you have checked off.
I think when I said, we are going to be so worried about the economy that we're not going to focus so much on the mental health after this virus. And I think because I'm so worried constantly about my heart,
Mhm.
that neither me nor the doctors are paying attention to other. It's quite possible, but next time I will make sure. But
Because
I want to really thank you very much for being so fantastic, giving me so much of your time. And I also want you to be safe, and please take care of yourself. You have provided us with some troubling but also important insights about the mental health crisis and the coming mental health crisis as a result of the coronavirus. And in my subsequent conversations with other policymakers, I will be sure to bring this up uh, and try to increase its awareness. But I also want to thank you formally for your service. We say this of military people, but we do not say that enough of people who are now actually on the front lines of coronavirus battle to save lives, literally. So, and I'm also very proud to say that you are my cousin, and I want to share a little bit of your glory. So thank you very much, Dr. Anjum, for
yeah.
talking to me.
No, thank you. Thank you for taking care of the policy side of matters. We're not trained and we don't do enough of that, although we feel very strongly about advocating for our patients. And I'm glad that I had this conversation so you're able to focus on some of those things. Although I would want to leave you with a silver lining in this cloud of corona is during times like this, you must have come across in your readings that people do the society becomes cohesive, right? Because we're all in this, and the best of you kind of shows up. People are more generous, more kind, wanting and helping each other to get through. I think so that will be a protective factor against suicide. It is the aftermath of this that you should be watching out for the mental health decline and the suicide and all of those increasing. So while we have it, we can celebrate it, but also prepare for what is to come.
Okay, thank you very much.
Thank you.